And also that you mentioned about the plan, the strategy when the crisis situation is happen. Also, the hospital have to have the plan for like unplanned IT downtime or the hacker hack the IT system like this. It's a proactive plan. Yeah, it's an important things.
Thank you so much. Yes, it has to be proactive. If you do reactive, then it's another case to learn. That's what it is. So basically, those are cases, and there are so many more type of cases that we have in our number one in our database, number two that we have read, and we have really got experience into. We have time? More question?
No, we have one case.
Okay. You have more case. Suddenly you have so many cases.
All right, so hi everyone, I'm Stella from ECRI. So the last case that we have time for, we'll be talking about bar-coded medication administration system. So these are systems where at the point of medication administration, you scan the patient's ID, and then you scan the patient's medication, and then it's supposed to verify in your system whether or not the medication is correct, right? Whether or not it's the right patient, whether or not the dose is correct, and whether or not you're giving the medication at the right time. Okay, so for bar-coded, so we have a case example here. Sorry, am I speaking too fast? Okay, I'll slow down a bit.
วันนึงค่ะอาจารย์ขาคือถามก่อนค่ะโรงพยาบาลอาจารย์ใครใช้บาร์โค้ดในการจ่ายยาบ้างคะโอเค this is a hospital that use barcode to prescribe อาจารย์ยกมืออีกทีค่ะเขาจะได้ถามถูกคนค่ะ1 2 3 4 5โอเคไม่อยากยกมือแล้วใช่ไหมคะโอเคค่ะ this is your target.
Okay, so we have in our room today a few hospitals who have implemented a BCMA system. So in ECRI, we have highlighted this issue multiple times already for the past couple of years. And this year also, we have our top 10 patient safety concerns report from ECRI. And you'll see that on number 2 on the list, we are also talking about errors associated with BCMA systems. Not because the technology is bad. We all agree that BCMA is a very good system. It's supposed to bring you value in terms of reducing number of medication administration errors, right? So it's only valuable if the technology is implemented correctly, if it is used correctly, if your staff actually follow the correct process in using the technology, and of course, if the technology is functioning correctly. All right. So just a important fact that I would like to highlight here. So when ECRI, we were performing our analysis on the reports that we have received from hospitals. So we were looking at technology-related adverse events related to medication errors. So technology-related medication errors. We found that more than 50%, so 66% exactly, of those events were related to bar-coded medication administration systems. So you can see that it really contributes, even though it's supposed to bring you benefit, it's actually causing more problems because maybe you didn't implement it properly, you didn't use it properly, or maybe you didn't maintain the technology properly. Okay, so some of the examples of unsafe practices when it comes to BCMA. So for example, you administer the medication even though you didn't scan the barcode, right? Or you administer the medication first, then only you scan the barcode. So this is what we call retroactive charting. So you're only writing down in the system once you have administered, which defeats the whole purpose of having the barcode system, right? And then another example of unsafe practices when it comes to barcode scanning is proxy scanning. So for example, if you go to a grocery store or supermarket, sometimes at the vegetable, at the cashier there, you bring a bag of apples to the cashier, and they will scan, they have a sheet of paper where they have multiple barcodes, you know? So that's what we call barcode proxy scanning, where you are not actually scanning the barcode on the medication, but you're scanning it from another source, right? So that will also contribute to more medication errors. And again, when you talk about human, do they actually understand what the technology is for? And do they actually understand the notifications and alerts that the system generates, right? So for example, you're administering a drug, you scan, and then the system shows error, or drug dose is incorrect. But does the staff understand what the technology is trying to say, right? But yet you still administer the medication. So let's look at the case study that we have. Next slide, please. All right, so this is an example of an event that we have received from our ECRI PSO. So this is on ignoring an alert from the BCMA system. So after the patient was admitted to the unit, the doctor requested a pain medication. Oh, thank you. Along with the scheduled dose of IV ciprofloxacin. So when attempting to remove the drug from the bottom drawer of the ADC, the automated dispensing cabinet, the nurse accidentally grabbed a dopamine bag instead, which was next to the intended medication. So the nurse went to the patient and verified the patient. But when they tried to scan the patient's band and scan the IV bag, there was an error that popped up in the system that said, not registered. But then since the nurse was in a hurry to administer the pain medication, they were in a very dark room. They didn't turn on the room light to check whether or not it's actually the medication that they want to administer to the patient. They didn't check whether it's the ciprofloxacin or not. So, and they just assumed that the scanner was not registering the barcode. So the nurse manually charted the drug and then administered the drug before resolving the computer issue. Okay. So after 30 minutes, when the nurse came to reassess the patient, they found that the patient had tachycardia. So they took another set of vital signs, reassessed the patient's condition, and then they reviewed the medications that were administered in the ER to look for why is the patient having tachycardia. So another nurse noticed that there's a dopamine bag there, and then they found out then that it was the wrong medication. So then the dopamine was disconnected, and then the patient got a lot better. So I think this is a very good case when it comes to systems approach. It allows you to think, the first thing that you think of when it comes to contributing factor is, of course, the technology. In this case, you can see that technology is functioning correctly, it's functioning properly. But when you think about the process, what went wrong? Right? What do you think went wrong? Can anyone answer? Would anyone like to share?
อาจารย์ target เราอยู่ตรงไหนนะคะ target เราที่ใช้ barcode ค่ะอาจารย์ barcode
Yeah, for those who have implemented BCMA systems in the hospital, perhaps you would like to share whether or not you encounter the same issues, or if you have any insights on the contributing factors, please do let us know. Oh, we have one gentleman over there.
So I guess when the machine already alert, the nurse or the staff have to concern about what happened on the system, or maybe they have to stop and look at the medication first before go to admin to the patient. I think that is the point.
Thank you so much. Yes, I do agree as well. So when in the process, I think I want to echo what Eric always asks. Does everyone think this is a human error? Is this a human error? Or do we have one late doctor?
I think it's human error. I think we might find situation like this from time to time. From a human errors, I think maybe like the ward is very crowded and the nurse have to do every job in the patient ward, so like she have to be hurried. Once the error, there's alarm system, but anyway, from the very need to be hurried, sometimes just ignore the system error that try to warn her. And the other things that about the place that we kept the medication, about the ciprofloxacin and dopamine, which is not the same type of medication. this is something that I think it's also human error. Yeah, I think it's
Thank you.
human error. Yeah.
Thank you. Yes, I think I agree with what you mentioned about the automated dispensing cabinet. Why did the machine allow you to dispense the wrong drug? Why was that error, right? Why was that process allowed? And in terms of the environment as well, I think I want to mention, you see in this case, they mentioned that the nurse did not turn on the light to check the bag itself, to verify the drug is the correct one. Why did this happen? Something simple like turning on a light could have prevented this error. Why didn't this happen? So when we think about system safety and human factor, we need to think about, how can we ensure the humans don't, don't contribute to these errors. So one of the things is that maybe ensure that the lights are on, maybe ensuring that the lights can be dimmed, but bright enough to allow nurses and your doctors to verify the medication, right? We have another comment. Eric, maybe you want to add on as well.
Hello. So
Yes.
I want to share something. Actually, they are the cabinet that can open when you scan the barcode on the wristband of the patient. I think that can prevent the error that might happen on this situation, right?
Would those
Correct.
be the automated dispensing cabinets?
Yeah.
They
That's
are,
the one.
yes.
So this technology, so what we're sharing, this is part of our ECRI's Top 10 2024 Patient Safety Concern, is number 2. If you download the ECRI's Top 10 report, you will see the case or the example of the analysis in our Top 10 report 2024. You just need to go to www.ecri.org and type there, look for Top 10 Patient Safety Concern 2024. It's already out, free of charge. We don't charge. So AED is used in your nursing or inpatient area, and sometimes in your specialist clinic, okay? Or in satellite pharmacy if you have. That's where you use it. Barcodes are supposed to minimize all this error. So usually, we don't have a big issue with the barcode scanning when we are at that site, because you're very specific to the armband or the barcode of the patient. Now, the question I ask is, do you push the equipment next to the inpatient bed and scan? Do you take the armband off the patient and walk back and scan? Do you take a photo, check, and then take your phone back there and scan? Now you see where the potential problem is. Do you see the potential problem? That is where I want you to investigate and think more. Dive deep. Dive deeper. Look and understand the workflow and the situation. What is it that you are doing on the ground? The big topic on the paper, you come to conference, you see we put big title and big topic, is good. But it's not enough when we are doing on the ground. We need to go down and understand. Simple barcode. Error can potentially happen, maybe not happen yet. Do you push the machine? I said, you push the machine next to the bed and scan. You don't do that. Then what do? Take the armband of the patient out. So sometimes nurse will say, okay, I have 3 watt to take. Then bring back there. Okay, scan. Then go back. What is the process? What is the safety process of doing that? Do you have a proper process? Using new equipment to dispense medication. The old way is to look at the patient profile. You have a file of your patient there. Last time, we stick the label on the file, you scan the file. You take the file, you go to the patient side, it's there. So our recognition, human recognition, is this file belongs to this patient. You take, you go, okay, it's there, I know, it's for him, it's for her, like that.